हेलो माय हेल्दी वेल्दी बडीज। आज मैं आप लोगों के लिए लेकर आया हूँ एक बहुत ही सिंपल सा क्वेश्चन। आर यू गाइस रियली हेल्दी? मुझे पता है आप कहेंगे कि आई हैव हेडेक यस्टरडे, आई हैव अ बैक पेन यस्टरडे, मैं काफी दिनों से बीमार हूँ, मुझे ये प्रॉब्लम है, मुझे ये इश्यूज है, मुझे ये इश्यूज हैं। बट लेट मी टेल यू माय फ्रेंड्स, in some aspect of your life, you are still healthy. And to connect all those missing dots, here we are, your family doctor. Hey my friends, I am Dr. Mohammad Kamran Alam. I have done my MBBS from All India Institute of Medical Sciences, Bhopal. And to bring to you all the importance of most precious gift of life, that is life itself, we are here, your family doctor. So what is it? आखिर हम करने क्या वाले हैं? बेसिकली दिस इज गोइंग टू बी अ हेल्थ एजुकेशन प्लेटफॉर्म जहां पे हम डिस्कस करने वाले हैं हेल्थ रिलेटेड इश्यूज एंड पैरामीटर्स को। हमारे वीडियोस में हम पिक करेंगे एक पर्टिकुलर हेल्थ रिलेटेड इश्यूज को और करेंगे उसे ब्रेक एंड एनालाइज, और आप उसे कह सकते हैं पोस्टमार्टम। विदाउट एनी फर्दर डिले, लेट्स गेट इनटू टुडेस टॉपिक। अब टाइटल से आप कुछ तो समझ ही गए होंगे कि what is it that we are going to discuss today. Today we are going to answer two basic questions which is gaining importance in today's world, and that is why there is so much dissent and dissatisfaction among patients towards their doctor and among doctors towards their patient. Why there is an increasing trend in the aggression of patients and relatives against their caregivers. किसी भी टॉपिक को समझने के लिए इट इज ऑलवेज बेटर टू गेट इनटू द बेसिक्स ऑफ इट। हमारे इस इशू का बेसिक्स है द वेरी फर्स्ट अपॉइंटमेंट ऑफ अ डॉक्टर, द वेरी फर्स्ट मीटिंग अ पेशेंट हैव विद हिज डॉक्टर। सो आज हम जानेंगे कि आइडियल डॉक्टर पेशेंट रिलेशनशिप क्या होता है। डॉक्टर पेशेंट रिलेशनशिप इज नथिंग जस्ट अ कम्युनिकेशन, और कम्युनिकेशन इज द मीनिंगफुल इंटरैक्शन अमंग ह्यूमन बीइंग्स। और ये मीनिंगफुल तभी होता है जब टेबल के बैठे दोनों तरफ के लोग एक दूसरे से कही गई बातों को समझ सके। एंड इसमें जिम्मेदारी दोनों की होती है कि बोथ ऑफ देम कन्वे टू देयर फुलेस्ट। हैव यू एवर वंडर्ड कि हम पेशेंट्स को पेशेंट क्यों बोलते हैं? बिकॉज ऑफ दैट वेरी की मोरल एटिकेट जो कि हम एक्सपेक्ट करते हैं पेशेंट्स में, दैट इज नथिंग अदर देन बट पेशेंस। एंड ड्यूरिंग द कोर्स ऑफ दीज लॉन्ग ईयर्स हमने ये तो समझ लिया है कि वी हैव दैट पेशेंस। अब चाहे डॉक्टर के लिए लाइन में खड़ा होना हो या फिर वेटिंग हॉल में घंटों इंतजार करना हो, वी हैव दैट पेशेंस। बट एज एवरीवेयर एल्स देयर आर some elements which can create nuisance, and in this case let's understand this with a simple example. Recently, I got a chance to visit a psychiatric clinic with one of my friends. हम दोनों वेटिंग हॉल में ऑलमोस्ट 2 घंटे वेट कर चुके थे। After that, there was a call from the cabin for a preliminary investigation like blood pressure and weight, for which he went into the cabin. I was there sitting, and at that very moment, a lady came with a kid, and she tried to snatch the very chair on which my friend was sitting. I insisted on her to don't do so because he might return after some period of time. But she kept on insisting, and she suddenly started screaming and yelling and started saying that have you owned this chair or have you got it from your home? At that very moment I realized that if I get into words with her, this is only going to create more nuisance. So it's better to be silent. Now, what do we learn from this incident, friends? Psychiatric OPD is the place where we have patients who are already struggling with their mental peace. And places like that, if there are people who shout and yell like that, is not going to create anything other than disturbances. Disturbances to those who are already disturbed. That is the importance of patience. It's not only for you, it's for the patients around you. So it's your cumulative responsibility to establish that basic attitude and etiquette what a patient is expected to have. ये हो गई केबिन के अंदर घुसने से पहले की बातें. Now we are going to enter into the doctor's cabin. and we have entered. After greetings, we started explaining our complaints. The most common complaint जो कि Indian patients के होते हैं कि their doctors don't have time. उनके डॉक्टर्स ना तो उन्हें टाइम देते हैं, ना उनसे बातें करते हैं, ना ही उन्हें एक्सप्लेन करते हैं. We should understand the very basic reason behind it. Now there are multiple reasons, but let's stick to the most important one. और ये है, although according to Indian government, in today's scenario we have a doctor-patient ratio of 1:834. Which is even better than the WHO recommendation, that is 1:1000. But is it uniform? No, my friends. जहाँ एक तरफ मेट्रोपॉलिटन सिटीज में डॉक्टर्स के नंबर सैचुरेट हो रहे हैं, वहीं दूसरी तरफ रूरल सेटिंग्स में अभी भी डॉक्टर्स की कमी है. एंड देयर आर मेनी इश्यूज टू बी डेल्ट विद टू सॉल्व दिस इशू. बट एज अ पेशेंट व्हाट वी कैन डू, वी शुड अंडरस्टैंड कि एक डॉक्टर को एक दिन में अगर 200 पेशेंट्स देखने हैं तो इट ऑब्वियसली मीन्स कि आपके लिए उनके पास काफ़ी कम टाइम होगा. एंड इफ दिस इज द सिनेरियो, देन वी शुड ट्राई टू मेक दैट मच कम्युनिकेशन विच वी हैव टू बी मोर मीनिंगफुल. नाउ हाउ वी कैन मेक our doctor-patient interaction a meaningful one? For that, let's start from the beginning. It is always recommended to jot down all your complaints a day before you are visiting your doctor into a sheet of paper with particularly mentioning the duration of your illness and what is the course of the disease, whether it has progressed or it has regressed. For example, if you have headache, then you should mention that we have headache for 5 days or 10 days and it is increasing or it has decreased after taking medications. If you have cough, how much time, what are the features? Now, you don't have to be in detail, but at least you should jot down the most important point which you should not miss. Secondly, you should have a clear-cut understanding of the medications you have been on. For example, if you're taking 5 to 6 medications, then you should know the name of each of that medication, or at least get a paper and write it down so that you can name them in front of your doctor, or you can take the wrappers of the medications itself. But make sure the wrapper should contain the name, not just a corner of the part which has just one tablet and nothing else. Now, once you have briefed your complaints to your doctor, it's the time for doctor to diagnose and give you a proper treatment. Now, it's up to you to get satisfied or not. If you aren't satisfied, get it clear with your doctor. And that is what our next point. Ask questions. When we were at school and we have any kind of doubt, we used to ask questions from our teachers. Then why not with our doctors? Doctors are professionals and we should understand that they are same as any other professionals we have. So, same as others, doctors can also commit mistakes, although the scope should be less, but there is still some scope. And our questions should be oriented in that way to minimize the overall error of the doctor. And for that, your questions should be disease and patient oriented. For example, if you have a cough for 2 weeks and you have visited to a doctor and he gave you medications, now you are curious to know about the course of the disease and what you are going through. So you should ask questions like, sir, what are the reasons behind this 2 weeks of cough? So for how long I have to be on medications? Or sir, for after how many days I will be back to normal? Now, these are the progressive questions which can overall improve the output of the doctor-patient communication. But questions like, sir, as I have read on Google, 2 weeks of cough means TB. So can I have TB? Or sir, should I get a CBNAT done? Or should I get a CT, MRI, anything else done? Or some might say that, sir, please treat my TB with a TB medication. So such kind of questions is not going to help anyone, but to create that unnecessary stress in the environment, which is nothing but deleterious to patients. Our next point is, don't expect a particular way to be treated. Let's understand this point with a very simple example. There is a patient who has came with a complaint of indigestion and heartburn. Doctor have examined, and soon as he mentioned the complaint, doctor get into the diagnosis and prescribed him medications. Now the patient has back in his mind that the doctor is going to examine, and doctor should at least touch his abdomen, examine him, and at least use stethoscope or some kind of medication, x-ray investigations like x-ray or something. But the doctor hasn't done that. Now this will create the dissent in the mind of the patient, and he is going to keep it for long, and that deteriorates the overall interaction. So we should understand that every individual is different, and the disease course and the treatment is also individualized. It is completely dependent on the doctor to opt the best out of the available options for that patient as per his professionalism. Some patients might question the doctor if he prescribed some investigations, while other doubt the credibility of doctor if he hasn't prescribed any investigations. So we should give an open air for the doctor to work freely and not just to comply with the patient demands. Next very important issue is with medications. It is a very bad habit of we as an Indian to stop the medication as soon as our symptoms gets away. Now we should understand that if the doctor has prescribed a medication for a particular period of time, then there is a scientific basis behind it, and we can't just overrule it. Taking a medication or just omitting it is not going to cause any benefit but harm. One most common and an important example of it is antibiotic resistance. We may deal with this issue in our next video, but for now we should understand that medications plays a very important role, and it is a responsibility of you as a patient to take your medications as mentioned by your doctor. Health is the most underrated and underestimated topic in India. One most common example of this is the loss to follow-up. Let's understand this with a very simple example. I have been diagnosed on my very first visit to my doctor. Now he gave me medication for 1 month and asked me to revisit his clinic after 1 month. But after 1 month, as my blood glucose level was almost normal and I was getting back to my ordinary life, and as there were functions in my family, I didn't bother to get a revisit. And after 2 months, one fine morning, I was unable to wake up. After some unsuccessful attempts of my friends and family, I was rushed to the emergency where I was diagnosed with hypoglycemia. Now, what is hypoglycemia? Hypoglycemia is the low level of glucose in your blood. That means your brain is not getting that glucose to function properly, and that is a life-threatening condition, my friend, if not treated on time. And why this condition arises? There can be multiple reasons, and the very basic explanation is that as the patient got his blood glucose level almost normal, there should be a change in his medication schedule or the class of medication. As he continued the same medication, there comes a condition where he lands up to hypoglycemia, or he might have skipped the meals or have taken the medication as per his discretion. So ultimately, the loss was on the patient's side. In practical scenario, if a doctor sees 200 patients in a day, do you think that a doctor can have a check on each and every patient he is seeing? No, my friends. It is the responsibility of the patient to prioritize their health, to keep their health a priority and get a revisit as mentioned and as asked by his doctor. So let's have a quick recap of an ideal doctor-patient relationship. It all starts with the basic etiquette of a patient, that is patience, to jotting down all your important queries, all your complaints in a paper a day before visiting your doctor and convey each and everything openly to your doctor. Ask questions if you have doubts that is to be genuine and problem solving. Take medication seriously as mentioned by your doctor and go for regular follow-ups because it is about your health and nothing else. So we will meet in next video with some other topic regarding your health to build a healthy India. Thank you.